I'm Jen Taylor Skinner, and this is the Electorette. On this episode, I have a conversation with Alexis McGill Johnson, the president and CEO of Planned Parenthood. I'm so excited to bring you this episode because I've been a longtime supporter of Planned Parenthood. Alexis and I discuss how Planned Parenthood has broadened their coalition to include organizations and activists from a variety of different movements, making their work truly intersectional and inclusive. We also talk about how Planned Parenthood will continue to move the movement for reproductive health care forward and how they plan to counter the attacks on reproductive rights, including those put into place during the pandemic. So without further ado, here is my conversation with Alexis McGill Johnson. Alexis McGill Johnson, welcome to the podcast.
Thank you so much for having me.
And so Planned Parenthood has been around for a century, over 100 years, but it feels like it's been under attack, at least from conservatives since, forever, at least that long, right?
Yes, that long.
Yeah, for a really long time. But, under the Trump administration, it feels like there's been a steep trajectory upwards with the attack. They've been really emboldened with, these attempts at abortion bans, complete abortion bans, clinic closures. But I think the thing that I'm most appalled about lately is the use of the pandemic to accelerate the attacks, right? What are some ways that they've exploited the coronavirus outbreak to further restrict access to reproductive care?
I mean, can you believe that? Yes, that we are all in the midst of sheltering in place. We are all in the midst of, worrying about our own healthcare and really kind of looking at how the healthcare system generally, the disparity within the healthcare system is being laid bare. And the Trump administration and many folks who have been aligned with the Trump administration in states like Texas and Ohio and Alabama decided to use the pandemic as a cover to push executive orders around access to abortion. And so in several states, keeping in mind, we're supposed to be staying at home. We are supposed to be, limiting our travel out of state in order to flatten the curve. Governors in several states decided that now is the time to basically push a political agenda. And they created executive orders limiting access to abortion care, saying that it was, in some cases outright banning it, saying that it was elective, it was non-essential. And what we saw was, people leaving state, going from states like Texas to Colorado, Texas to California, driving in many cases dozens of hours just to get access to medication abortion because they weren't able to access it in their own zip code. So look, since day one, we know the Trump administration has been pushing policies to undermine access to sexual and reproductive health care. But just in the last 3 months, particularly at the height of sheltering in place, many who I think had cover from the Trump administration were so focused on using this time to push a political agenda. And it was really just unconscionable.
Saying that abortions were non-essential, what actually happened was, and I think, and you can confirm this for me, is that a lot of the clinics had to cancel active appointments. Is that true? And when that happened, what did people actually do?
Yes, absolutely. I mean, look, we had just heartbreaking conversations with providers at our Planned Parenthood health centers across states and even some states where abortion hadn't been banned because there just had been a lot of confusion. So providers are getting on the phone. They're calling their patients. They're saying, either you have 24 hours to get in here, or your appointment has actually been canceled and we can no longer serve you and we'll have to refer you to a place out of state. We've had patients calling into the health centers and the call centers trying to really, just because there was so much confusion that was being sown during the executive orders. As the orders came down, Planned Parenthood, along with ACLU and Center for Reproductive Rights, other organizations were fighting each ban in each state that was putting them down because we wanted to ensure that both clarity and to ensure that our patients had access to the care. And so there was just a lot of confusion that was happening. And, abortion is essential healthcare, right? It is time sensitive. And so, so the choices that patients were faced with were essentially to travel out of state to secure access. And, putting themselves more at risk, right? Both for coronavirus or spreading coronavirus throughout through the areas where they were traveling. And then, also, there's a story of a woman that was in one of the briefs who had to put her children in the car with her elderly mom, drive across state lines, I think 12 hours to Colorado and back. And those are the people behind these orders, right? Those are the people who are experiencing, on the other end of the political agenda that, it's just so unbelievable.
It is. And what's interesting is that this isn't much different from what it was before. Like, people in certain communities had to travel across state lines to get an abortion. So this just exacerbated those obstacles.
Yeah. I mean, we take for granted that Roe is still the law of the land, and the majority of Americans believe that Roe should be the law of the land. But there are states where there are, no abortion providers, and there are states where access is so limited because of the multiple restrictions that have been put in place that it makes it extremely difficult, particularly for low-income families, particularly for people of color.
Yeah. So can we talk about a few of the restrictions that were put into place before the pandemic? And I think one of the big ones was the Title 10 gag rule, right? And, that bans providers from telling patients about, how they can, safely and legally get access to an abortion. And just a comment, this isn't necessarily a question, but I think that, it should be illegal in all forms of healthcare to withhold information that's useful to a patient for the purposes of manipulating their decision, right? I just think that should be illegal. You'd never do that to a person with a heart condition, right? You wouldn't do that, right?
Right. No, you totally wouldn't. You totally wouldn't. It's right. So first of all, like for listeners who don't know the Title 10 program, it is a program that is the nation's kind of oldest and first family planning grant that, provides access to birth control, particularly in low income communities, rural areas. And when they came out with decided to enforce the gag rule in last August, the impact of that, the resources, particularly for an organization like Planned Parenthood that served 40% of Title 10 patients, the impact was very tangible, right? It was people who oftentimes don't even know that they were getting public assistance for their birth control, all of a sudden had to start paying, in ways that they weren't expecting to or anticipating. And I think it's just a great example, this gag rule that was asking providers to not give a full range of options for patients if they found out they were pregnant. It was asking our providers to give substandard care. And that was just completely unacceptable, which is why we were forced out of the program.
So I'm just curious. I was thinking about that, and I'm thinking about, what that looks like practically. Someone comes in to a healthcare provider and they say, I need help. And, following this gag rule, the provider does what and says what?
Well, I mean, if you come to a Planned Parenthood, you get the full range of information because we decided we weren't going to comply with a gag rule that asked us to provide substandard care. But it would have looked like, we can't, if you came in and you were pregnant, and you asked what your options are for termination, the provider would have to say, if they were accepting Title 10 money, I cannot give you information on that, or go try Google, or, I mean, it's like ridiculous. Right. And I think like the heart of it, Jennifer, honestly, is the relationship between a patient and a provider is very intimate. It has to be based on trust, right? On getting the right information to take care of your healthcare needs. And if you are a provider and you all of a sudden cannot give the full range of information that someone is asking for and seeking, it is compromising that level of trust between the patient and the doctor. And so I think it's really important to understand that this isn't just about cutting off access because people don't want to support access to abortion. It is also undermining the basic tenets that should be guiding a relationship between a patient and their provider. And I think that's really where, Planned Parenthood in particular, stepped in on the side of our providers and our patients to make sure that as a trusted messenger, as a trusted resource, particularly around sexual and reproductive health care, we would not be compromised.
Yeah. One of the things that I hear more people talking about or beginning to talk about is the appointment of these conservative anti-abortion judges. And I like to call them anti-healthcare judges because abortion is healthcare, right? Yeah. And, the important thing about it is that all of the other changes we've talked about, like the changes to Title 10 or, the closing of clinics, those can be undone, with majorities in Congress or the Senate or with the White House, but this can't, right? These are lifetime judges.
Yeah.
And even Trump himself said that, I think he made a comment about overturning Roe v. Wade would happen automatically because he's putting in pro-life judges, right? Like he's aware of this. So what does the picture look like now? How many judges have been appointed who have these views?
I mean, we are almost looking at almost 200 judges that have been appointed during the Trump administration. It is, I mean, as you say, I mean, when you layer on the number of restrictions that we have seen over just last year, we saw 303 abortion ban restrictions introduced in 47 states and state legislatures. So let's pull the picture together and why these judges are so important. You've got 300 restrictions in 47 states. You have almost 200 judges now that have been confirmed. And, as an organization, quite frankly, as a movement, we've relied on the courts as our stopgap when very harmful bans and restrictions to healthcare come about. We are able to actually use the court to have it be considered. Now we have these 200 judges who have incredibly restrictive thoughts on access to healthcare, abortion healthcare. Somebody like Corey Wilson, who's about to get confirmed, he actually holds a record that demonstrates incredible hostility towards not just healthcare, but also voting rights, racial justice. We have Sarah Pitlick, who doesn't even believe in IVF. We have very conservative judges on access to reproductive health care that will now be adjudicating as to whether or not these bans should be upheld or not. And so when you think about the impact, obviously, we oftentimes have the conversation about the Supreme Court, which is also critical and crucial. And we have a case before the court right now. But when you think about the pipeline from the bans through these circuit federal judges to the Supreme Court, where there are already, I think, 18 cases now winding their way up, in addition to the one that was heard in March. The world of Roe, the ability for Roe to remain the law of the land, is not only subject to potentially being overturned. It could also just be gutted to the point where it's a name only. And that's what I think we really have to tell the big picture, the stories, and how strategic those who've been anti women's healthcare have been in trying to push their agenda.
Wow. So, correct me if I'm wrong, but it feels like 10, 15 years ago, even considering a judge with these kind of archaic views, they wouldn't have been considered even. Is that fair to say?
Absolutely. I think it's fair to say. And I also think, 10, 15 years ago, I started working as a volunteer with Planned Parenthood in 2010, right at the beginning of the 2010 Congress. And it was in that moment during the redistricting, obviously the census redistricting, the Tea Party that came into play, and this alliance around, pushing bans and restrictions, targeted restrictions just for abortion providers, really started to escalate. This is the reason why elections matter. This is why, taking the census matters. This is why our really focusing on restoring some core tenets around how democracy functions and the checks and balances matter, because we've had now these successive elections that have completely transformed our state legislatures, created the opportunity for these bans to be put out. And then we're also, having to unwind so much, right? I mean, that's what keeps me up at night, quite frankly, just thinking about the massive damage that's already been done and what we will need to do if we get a women's health champion in office come November.
Right. Yeah. Sorry, I was just stressed out listening to that.
I know. It's crazy.
Oh, God. Okay. Well, but I guess my point is that even 10 or 15 years ago, it's obvious that Democrats wouldn't have considered some judges with these views, but I think a lot of Republicans would have rejected, such extreme views. Maybe.
Look, I think that what we have now is a vocal minority who has the levers of power. And, when you consider the fact that the majority of Americans actually do believe that Roe should be the law of the land, when you consider the fact that there is no state in the union that believes that abortion should be banned, and yet because of these technical changes, right? Because of the makeup, the legislature has changed because of this, the way that the districts were gerrymandered. You actually have people with a minority view who now have more power. Prior to 10, 15 years ago, the electorate was more reflective of communities. And I think that's the fundamental shift and change that we have to look at. And that's what we have to look at restoring. And it will take, it will take another decade, right? I think like we're at halftime now at 2020 and we're already, we like have to go back in the locker room and get ready for the next fight after this election, because it's going to take a while to undo a lot of the damage that we've seen through the last decade.
Yeah. I think for me, and again, you can correct me if I'm wrong, there seems to be a missing piece in the way that people, and I'm speaking specifically about people who don't vote consistently for Democrats, I guess those would be Republicans, and that, like if they do support access to abortion, they aren't necessarily making the connection that their voting decisions at the state level, local level, it's counter to what they actually believe. And that seems to be the missing piece. But
yeah, I mean, look, I think that traditionally folks who have been progressives have not actually voted on the courts as consistently. And I think that is also what's missing. It's the local level, but it's also kind of with a very clear-eyed view of what the court makeup should be. And that's really where our big battles are right now. I mean, look, honestly, if Roe gets overturned, there are 25 million women who are living in states right now who would not have access to abortion. That in itself, if you think of, and we're talking about women of reproductive age who would also overlap with a universe of voters, that's a huge impact that we have to really consider how we awaken and make sure that they understand what's at stake.
Right. I was talking to someone recently about the number of changes since Roe v. Wade was passed, right? Has it been 40 years?
Actually, 47. Yeah.
47. Like thousands and thousands of restrictions, right? And it feels like, I mean, maybe I'm not being fair. It feels like it's taken us a really long time to wake up.
Yes. You know what? The reason I say 47 is because I'm 47 years old. I'm as old as Roe. And I didn't grow up thinking that this was ever going to be a thing, right? I mean, of course, there's always more that we can do to support real, meaningful access, right? Because you can have the right, but not actually have the ability to execute on the right, and that's has a lot to do with our healthcare system and other intersections. But like the fact that one wouldn't have access if they were seeking abortion just was not something that I think my generation really was growing up worrying about. And quite frankly, we were taking advantage of all of the fights that had been had before us, and I think that's why it feels like the sky is falling. Like I want to say the sky is falling. You guys, this is really happening, and there are a lot of people who are realizing, wow, it is actually on the line when they see all of these structural pieces come together.
No, you're exactly right. We're in the same boat. I mean, I'm thinking back, when I was in college or, when these things should have been, really important to me. I just took them for granted and thought that they would always be there, and things were happening that were really important that should have been paid attention to by myself, back then, and the same is true for Planned Parenthood. I mean, just a bit of a personal story. My mom was a nurse, and I remember, she would work in Planned Parenthood clinics, right? And that was, ages ago. But I remember that. It's just, kind of like not really thinking about it. It was something that Planned Parenthood, it had been around forever. It would always be here, and you're still here, yep. Thankfully, yep. Right? But, you're not going anywhere. You've been here for a century. But, just thinking that these attacks would not be effective, right? But one of the things that I have noticed recently about Planned Parenthood, under the Trump administration specifically, and, around the role that you have in the community, is how intersectional your work is, right? I mean, because, going back to the story about my growing up, I made the connection of Planned Parenthood to abortion, which a lot of people make that connection, right? But looking at you now, I see just how intersectional it is. I mean, you've been partnering with, the movement for Black Lives. I saw something about that. Mm-hmm. And, with, activists from the DACA movement and the LGBT community, to just name a few. So I'm assuming that's been strategic. But have partnering with these organizations, has that helped make your coalition stronger going forward, do you think?
Absolutely. It has been strategic work, but it has been very intentional heart work, right? When you actually, Planned Parenthood centers the patient, right? We are first and foremost a healthcare provider. Our affiliate health centers are providing actual care in communities, and the people for whom they're providing care are living at the intersection of all these issues. That we're providing care for, undocumented immigrants, for Black communities, for workers, for folks who may not have access, may not even have the ability to pay. And Planned Parenthood health centers provide that care regardless of immigration status, regardless of ability to pay. And, I think the decision to align with organizations like Movement for Black Lives, or to be involved in the DACA fight, or to fight for trans lives, has a lot to do with the fact that all of these issues are interconnected, right? They're in our workplaces, in our schools, in our public institutions. It's in our healthcare system, and we have, I think, a big platform to really think through the through line, which is that we fundamentally believe in freedom, and we believe that you should not be criminalized for seeking access to abortion, for determining your own life course. You should not be criminalized for seeking access to freedom through immigration. You should not be criminalized, just as we were talking earlier around just some of the crazy microaggressions that people are just living while Black. And, we won't be able to ever achieve access to justice if people don't have the right to bodily autonomy. And we definitely won't be able to achieve freedom. And so thinking about how we imagine freedom and fight for freedom, I think that's actually what we're seeing now. And it's been, again, it's been very intentional work. It's been very hard work inside of our organization, inside of bringing movements together. But what we're seeing right now is so real, like the grassroots momentum that has taken the country by storm, that is led by young people, that is led by Black and brown people, by queer people, really requires not just us as an organization, but us as movement leaders to align and make sure that we are fighting and standing on the same page.
Yeah, it's really beautiful. It's in the midst of all of this, all of these terrible things that are happening, the people in the streets, even though it's heartbreaking because you think like, are they risking their health?
Mm-hmm.
But it is really beautiful to see, right?
It is. I feel like very liberatory when I watch it. I have to be honest. I think that it is. I keep saying, like, when people are like, how are you doing? I'm like, I kind of just have this liberatory vibe right now because I'm seeing these folks who are just so unapologetic about who they are, right? I mean, like that's at the core of freedom, right? It is like, I know who I am. I know what freedom looks like. I have a vision around it. And once you get that taste, you are not going back, right? You're going to continue to fight for what it means for you to live your life on your own terms. And I think the intersection of these movements and having these conversations and lifting up is incredibly powerful.
Yeah. Yeah. Alexis, I want to tell you, and if you don't have this already, you can take this idea. I want a t-shirt that says abortion equals healthcare.
Yeah.
Right. Because that's missing. I want everyone to understand that abortion is healthcare. It is abortion. And I just want people to not shrink away from abortion in the way that, sometimes happens in these debates, and that, it is healthcare. So if you are not voting for people who are in favor of abortion access for all, you are voting against healthcare. That's just my comment.
100%. I am with you. I take it. I will send you a t-shirt because it is happening. I mean, look, just last week in the middle of the night, you know what happened in Tennessee? These politicians created one of the craziest bills to ban abortion at nearly every stage of pregnancy, including before people even know that they're pregnant, right? It's like the most restrictive in the country. It'll be the first abortion ban to be enacted this year. And, you look at something like that, and like if people understood it as healthcare, they may have a different reaction to it, rather than letting something like this craziness pass in the dark of night.
Right, exactly. And that's why I want it on a t-shirt, right? Because I have these conversations, but they're conversations between people like you and I, right? Who kind of understand that. We read the books and, you're leading an organization, right? But the average person, I think, even on the progressive Democratic side, I don't know if everyone can say that they believe that abortion is healthcare. They view it that way. I think they still think of them as two separate things. There's healthcare and then there's abortion, right? And I think it would help everyone if we started talking about them as if they're the same thing.
I think you're absolutely right. And I think that, look, Planned Parenthood is, again, first and foremost, a healthcare provider. And, we see abortion as part of sexual and reproductive health care. And that's what we provide, everything from STI screenings to cancer screenings to birth control to abortion. And all of those are tools as healthcare is, right? Tools to help you live, a fully free life. And so I am 100% abortion is healthcare. I think it's very simple. I think it is, I think it will make a great shirt.
Thank you. So, at this point, I know this is the thing that keeps you up at night, but, how do we begin to turn things around? I know that there's multiple things to do, but what's the most pressing thing or the most pressing three things? Is it, electing people at the local level who are champions for reproductive rights? Obviously it's voting, but the average person, like, what should they be doing to help, if this is a concern of theirs?
I mean, it is vote, vote, vote. I think, it is absolutely vote, vote, vote. I think we're heading into an election that we've been saying, is unprecedented, is the most important election of our lifetimes. And I think that making sure that we are focused on that, educating ourselves about what is happening to access to reproductive health care, specifically abortion, I think is going to be really important. And, I think lifting up champions and being in it for the long game, right? I think part of the challenge here is that it's taken us a while to get to this point where access to reproductive health care is literally on the verge of being lost. And it's going to take us a long time to restore, right? That this is a fight that will be, has been relentless. It has been unyielding, and we have to prepare ourselves for what it will take to not only to restore our democracy, but also to ensure that that people's access to healthcare doesn't depend on their zip code. And so, voting is a key piece of that. Having a long game is a key piece of that, and staying, focused and strategic and relentless back. And I think making sure we are lifting up our champions and, and focused on the real momentum. We saw it just in 2018, 2019 in state legislatures. 2018, we got a pro-choice Congress. That was the largest pro-choice majority that we've ever seen because we stayed vigilant from 2016. In 2019, we got governorships in Kentucky and in Virginia. And that state legislature in Virginia, flipped back Democrats, and we were able to undo a lot of horrible legislation that was done around access to abortion healthcare. So, it is a long road. Politics, these are moments inside of movements, and that elections are critical. But if you have a movement lens, that means that you were involved for the long game. And I think it's really important for folks to engage.
So it sounds like we need two T-shirts. We need, abortion is healthcare, and we need, vote for your state legislators.
Indeed, yes. And I'm just going to add another one, which is basically movements are never settled. Movements are never settled. We have to stay engaged. We have to stay vigilant. And had we known, had I known in 1973 when I was coming up that this was going to be the fight that I was having 47 years later, I wouldn't have ever said, "Oh, I thought that was settled."
Yeah, no, that's really profound. No, that's a really good thing to end on. Wow. Well, Alexis McGill Johnson, thank you so much for all the work you're doing, and I truly appreciate you, and thank you for joining me today.
Oh, thanks for having me, Dan. So great to talk to you.